Hey, Dr. Moses Laufer, and welcome to our Tick Bootcamp podcast.
Hello, thank you for having me.
Well, Dr. Laufer, I need to take a moment to pause and recognize that I'm here with Dani Tygr to co-host this brilliant interview that we're going to have with you. And Dani was our guest on episode 254 of our podcast titled Beauty Beats Lyme. Dani's an amazing hairstylist, but more importantly, a beautiful soul, and she's become an amazing friend to both Rich and I here at Tick Bootcamp. So Dani, can you say hello real quick?
Hey, Tick Bootcamp fam. I just wanted to hop on real quick and introduce myself if I haven't met you before. If you're a first-time listener, I am a huge fan of the Tick Bootcamp community. And of course, Matt and Rich are dear brothers of mine at this point. I am super fortunate to have been able to share my story with you all. And part of my story, probably the biggest part of my story, is my amazing doctor. You guys hear me talk about Holtorf all the time. That's where I get treated. My doctor is Dr. Moses Laufer, and we are so excited and so blessed to have him on the podcast today. So with that, take it away, Matt.
Well, I just have to say, we are really excited to have Dr. Moses A. Laufer with us today as well. And I'm saying that in case people want to Google him, and we'll have links in the show notes, of course, where people can go find more information. But I want to start by giving a little brief background before we get into the actual interview, because Dr. Laufer has a really impressive background. He started out in medicine over 40 years ago as an internist. He then went on to be the director of physician services and programs for the Kronos Group, where he trained more than 120 doctors across all 50 states in the treatment of thyroid and adrenal dysfunction, chronic fatigue syndrome, fibromyalgia, and the use of bioidentical hormone replacement therapy and nutraceutical therapy. This work allowed Dr. Laufer to realize that most of his patients were suffering from chronic Lyme disease, and that was what led him to his next change in his career when he went over to the Holtorf Medical Group, where he is today, and where he was able to help Dani in her healing journey. So Dr. Laufer is also a diplomat of the American Board of Internal Medicine, and his credentials go on and on and on. So I'm going to stop there. But again, Dr. Laufer, I just want to say thank you for joining us, and we're so happy to have you on this podcast.
Thank you very much.
Why don't you start by telling us what it was like being a young medical student and starting out in your career as an internist? Did you ever think you'd be where you are today, being a Lyme literate doctor, helping so many people in the Lyme community?
No, not in a million years. Okay, and I mean, as you know, I mean, really, recognition of Lyme as the underlying, problem for a lot of conditions is really fairly new. Okay, I mean, as you know, many people, were diagnosed with chronic fatigue syndrome, fibromyalgia, and initially, it was all, in their heads. I mean, they're really, because most routine tests invariably, turned up, negative. I mean, there were no major abnormalities that could be identified. So, the patients were labeled as malingerers, or, simply, just didn't want to get better, essentially. Okay. And really, not until, chronic fatigue, fibromyalgia eventually were recognized as legitimate diseases. But then, the underlying, and at least in my practice, the underlying cause of about 75–80% of patients with chronic fatigue and fibromyalgia is Lyme disease. Okay, and it's not just Lyme; it's Lyme with the co-infections. Okay, we talk about Lyme, Babesia, Bartonella, Ehrlichia. The sicker the patient, the more likely you are to have the co-infection. So it's not enough just to to stop with the Borrelia. You do have to certainly include Bartonella. And it's again, the treatment is difficult. It involves taking multiple antibiotics, not necessarily antibiotics, but treating multiple conditions, specifically inflammation, which is really the underlying problem for everything. I mean, inflammation, triggers immune dysfunction, it triggers cognitive dysfunction. The other thing that I found over the years, especially when treating patients with Lyme, is that gut health was always ignored. Gut health, you're having some stomach issues, take a couple of antacids, call me in the morning, or take a couple of, just over-the-counter medications. But the reality is, your gut is your second brain. Your gut doesn't work well. The first place that we get inflammation is the gut. Okay, and you produce, chemicals, cytokines, and then they lead to generalized inflammation. Then, when you have a severe inflammatory reaction, your immune system begins to malfunction, and eventually, you have a lot of cognitive dysfunction. So again, it's important not to ignore the gut. Okay, part of the problem with treating a lot of Lyme patients is that a lot of the, therapies involve taking medications that could potentially have a negative impact on your gut. And so, you're sort of between a rock and a hard place. Okay. You have to be aware of gut function, but at the same time, you want to try and do, something to, address the underlying problem. So you do have to explore, other, avenues of treatment. And I'm talking about IVs, I'm talking about peptides, sublingual peptides, anything to avoid the gut, if at all possible. And so that's really where we are, where we are today. Antibiotics. And when I first started treating Lyme, and we're talking about 14 years ago, the standard treatment was, antibiotics, but it was not just one antibiotic, because as you know, the Lyme bacteria mutates, okay? And each form of Lyme is sensitive to different antibiotics. So, treatment always involved taking multiple antibiotics. And I would treat patients with antibiotics for a year, 2 years. And, we were not seeing any real benefit. Patients simply were not getting better, okay? And so we had to start looking for other ways of treating patients. And, and again, addressing inflammation, addressing immune dysfunction, just trying to get the patients to be, much more functional. And that is the key. Does everybody get, complete relief? No. Some patients, respond very nicely, and they function without any difficulty. Other patients, 50, 60%, but it's better than the alternative. It's better than where they were before. At least they're able to, to have a life, which is really, what we're trying to accomplish. And again, there are some patients who simply will not respond to anything, no matter what you do. And I do, in my practice, I can think of at least 2 patients who simply, and I have tried everything that I know, and they simply just do not respond. And obviously it's frustrating for the patient, and it's incredibly frustrating for me, but it does happen, and we just don't know why. Okay, that is the reality. Now, I'm
just going to jump in real quick. I apologize,
Sure.
But I want to back up, because before we get into more about the challenges of Lyme treatment and beyond antibiotics and the shape-shifting behavior of the Lyme bacteria and the deeper ways of treating that can bypass the gut and really geek out over that stuff, I just want to circle back to, young Dr. Moses Laufer, right?
Yeah.
You started as an internist. What caused you to leave that area of medicine and go work for the Kronos group and start focusing on these people with thyroid issues and adrenal issues and chronic fatigue and all those types of issues?
Again, it was, traditional medicine limits you in terms of the kinds of things that you can do, for patients who have those conditions. And so really, I was trying to find, alternative ways of treating patients. Okay. And that really what led me to the Kronos group. Okay. But they were kind of, they were looking for alternative ways of treating patients. And so that was very attractive to me. And that's the reason why I chose to go that route. Okay. It was really just frustration more than anything else.
Right. So you got frustrated of the limitations and the handcuffs and the lack of curiosity in traditional medicine. So you went to the Kronos group to explore other ways to help people because you felt handcuffed. Now, at that point, you were new to this, and you're obviously training 120 physicians in all 50 states of the United States. What were you teaching them at the time? What kind of treatment protocols were you training these doctors in to treat these chronic conditions, which probably were Lyme disease in many cases, like fibromyalgia and like chronic fatigue syndrome? So obviously this is many, many years ago, but what were you doing at the early stages of your career when you first started dipping your toe into the water of treating chronic illness?
Really looking for ways of dealing, with what we felt was the underlying problem, which was inflammation. Okay. Looking for different approaches, to deal with the inflammation. And that really was kind of the driving force of the group. Okay. We treated the standard stuff. We treated, we treated thyroid disease. Even then, though, we were treating thyroid, exclusively with with T4. Okay, which I later on recognized that that really isn't necessarily the best solution for treating all patients with hypothyroidism. Okay, and so that was a little bit limiting. But hormone replacement, certainly, female hormone replacement, looking at adrenal function, looking at growth hormone, which is always ignored. Okay, and the reality is that a lot of these patients, whether one of their major complaints besides gastrointestinal issues is issues with sleep. Okay. And if you don't sleep well, obviously, growth hormone is going to be an issue. And if your growth hormone levels, if you don't have adequate growth hormone levels, you are going to pay a price. And so, we found that, patients who don't sleep very well, over time, they develop a lot of cognitive dysfunction. And again, that's one of the things that we found, that the growth hormone had an impact on, increasing circulation at night. So a lot of the garbage that accumulates throughout the day gets washed away and it doesn't get deposited. And so it was really just trying to find. It was interactive. Okay. We're not trying to look at just one system in isolation. We are trying to look at the entire body, trying to find, how things, behaved, as a unit. Okay. And not just breaking it down and only dealing with one section. We are trying to deal with the whole body, essentially. And that was really the thing that we did at Kronos.
So, Dr. Laufer, we know that inflammation is one of the main issues why many of us experience symptoms in the Lyme community. So at this point back then, not today, not some of the cutting edge things you're doing at the Holtorf Medical Center, but back then when you were with your Kronos group and you were training all these doctors, what types of tools, whether it be drugs, alternative medicine, food, etc., the wide variety of tools you had at your disposal, what were you doing to help quell inflammation in your patients that you were treating at the time?
Well, again, the first thing was really addressing, gastrointestinal function. Okay. And, the reality is that, a lot of people had sensitivities, not necessarily full blown allergies, but certainly sensitivities that could cause, significant gut inflammation. Again, when you have the gut inflammation, you produce the cytokines, those get absorbed, and then you end up with systemic inflammation. So, dietary changes, being very much aware of food sensitivities, doing some, food sensitivity testing. Okay. And a lot of times, those tests would not necessarily, give you much information. So it was a question of, trying to, food diaries, making sure that people, kept a very detailed food diary to make sure that, if they were having symptoms after eating certain substances, we would avoid those, for at least 2 weeks to see what kind of an impact it had on their overall well-being. Okay. So we did a lot of focused on trying to find things that trigger inflammation. Certainly, diet can trigger inflammation, gastrointestinal dysfunction, but it was really mainly a lot of it was really focused on gastrointestinal function, and that really is the thing that we kind of to evaluate inflammation. Again, there were some of the tests that we use for inflammation today, were not available to me then. Okay. Mm-hmm. Sedimentation rate. Okay. C-reactive protein. Those are things that were available. Okay. Which are really, for all intents and purposes, they're worthless. Okay. Especially if you're dealing with somebody who's got, issues with chronic fatigue, who's got Lyme. Those inflammatory markers don't give you any information because, they're invariably, come back, either, very negative or, really slightly positive. So they don't really, they don't really tell you very much. Okay. Now we have, inflammatory markers now that are a little bit more sensitive, more specific. And so, that's, those are the ones that we're using, today.
So we're going to get to what you're doing today for testing, but I want to better understand what brought Lyme on the table for you when you were at the Kronos group, right? Because you're treating all these chronic patients, and then all of a sudden you realize, wow, many of them have Lyme disease. But what put the thought Lyme in your head?
Really, the reality is that even at Kronos, we were not considering Lyme. Really, we were not. Okay, Lyme disease, was this, exotic disease only seen in, in certain parts of the United States. If you came from California or from Nevada or whatever, Lyme was not a consideration. Okay. So even at Kronos, we were really not considering some kind of an underlying infectious process triggering the fatigue or the fibromyalgia, the chronic fatigue. We were not considering that. Really, we were not. Okay. So that was I mean, that's something that I really, I mean, not until about 14 years ago, did I begin to did we begin to realize that, in fact, the infection, was the thing that was triggering, all the changes.
So tell us about that. Where were you 14 years ago in your career? And what put that on your radar that infections and Lyme disease could be triggering all of these symptoms you've been seeing in your patients up until this time?
Again, we started seeing a lot of patients with chronic fatigue, fibromyalgia, and no matter what we did, they were not responding. Okay, I mean, it was obviously frustrating, and then we started looking at immune function. We started looking at natural killer cell function. We started looking at immune globulins, and then we started looking at some more sensitive inflammatory markers. And that's when we realized that the underlying problem was in fact an infection. Okay, that was what was triggering all the dysfunction, all the problems. And again, 75-80% of patients, that was their underlying problem. And so that's when we at that point we realized we had been missing something. Okay, I mean, but again, if you did all the standard tests, most of the tests would always come back negative. I mean, everything normal. I mean, so why are you having so many symptoms? Why are you so symptomatic? And again, then we began to realize that again, you need to look for other infections that are not common. Okay. And we had to get away. The biggest issue, believe it or not, was, I mean, the community is believed that Lyme disease, yes, acute Lyme disease was a legitimate diagnosis. Chronic Lyme disease, non-existent, especially if you lived in a part of the country that I mean, supposedly Lyme disease was not an issue.
Well, I find it interesting that back then, 14 years ago, testing was even worse than it is today. I feel like, at least now we have more private labs and we have more tools available to us to diagnose Lyme. But it sounds like you kind of stumbled into Lyme and co-infections by being desperate to say, why are my patients not getting better? You were frustrated.
Absolutely.
You were trying to figure out what it was. And then you realized, wow, mostly all of my patients have Lyme disease. How did you come to that conclusion with such poor testing available at the time?
Again, we started looking, and really the big thing was looking for different, inflammatory markers, okay, and looking for immune dysfunction, and so that's what we kind of focused on. And we realized that certainly immune dysfunction was prevalent in almost certainly 90% of patients who presented with chronic fatigue, fibromyalgia. Okay, and so the question was, what was triggering the immune dysfunction? And so we started looking for different tests, okay, to evaluate that inflammatory reaction. And so, that's, and Dr. Holter, I have to give him all the credit. Okay. I mean, he was very much, he's very aggressive. Okay. About contacting labs and trying to come up, with different testing, to evaluate that inflammatory reaction. And again, once we realized, okay, that was in fact the case, then it really changed how we approached, all these patients.
So you were at Holtorf Medical Group at this time, and you were working with Dr. Holtorf, and that's when you had this epiphany, right? And it sounds like it was just pure determination and persistence, working with every lab you can partner with, and putting all these clues together that resulted in Lyme disease and co-infections in most of your patients, right?
Correct.
Okay. So at this point, I just want to ask, what caused the change in your career from Kronos to Holtorf, where you started to make these discoveries?
Oh, essentially, I mean, Kronos, at some, unfortunately, at some point, it became more about, really, I mean, I hate to say this, but it's just a money-making operation. Okay, I mean, selling, growth hormone. Growth hormone was the answer to everything, and so, I mean, they lost their way essentially. Okay. And it really became more of a, just a money-making, operation. And so it became very frustrating, push growth hormone, do growth hormone, more growth hormone, and that's the answer to everything. And so that was the reason why, plus I was doing a lot of traveling, and it just, it became very unattractive.
But tell us about your early years at Holtorf. You're obviously doing a lot of cutting edge stuff at the time. This is 14 years ago.
Right.
And you're making a lot of groundbreaking discoveries. What things were you finding? Like, so obviously you're making all these connections. Is there anything, any cool stories you can share with us about your work with Dr. Holtorf?
Initially with Holtorf, our primary focus was on hormone replacement. We were dealing with a lot of, not Lyme, with the, thyroid issues, hypothyroidism, hyperthyroidism, adrenal insufficiency. We were dealing with the, menopause, so, primarily it was really just hormone replacement that we were kind of focusing on. Okay. But then, we started getting a lot of patients, who were having, a lot of issues with chronic fatigue and, fibromyalgia. And yes, we addressed their hormones, but they were still very symptomatic. And so the question was, we've taken care of the thyroid. They were hypothyroid. We're taking care of the thyroid. We're taking care of their adrenals. They're sleeping better because we replaced some of their estrogen and progesterone. But so why are they continue to be so symptomatic? Okay, and so that led to let's find out what's triggering all this. And so that's where we began to look for other reasons for patients to feel the way they did.
Understood. So I want to pose a question, and there may not be an answer to this question, but those of us in the Lyme community experience two reactions when it comes to, I feel like, their thyroid, hypothyroidism, hyperthyroidism, and even weight gain. And I know you have a very strong background in weight management and the thyroid and hormones, etc. So, for example, I gained a significant amount of weight when I got sick. We have others that come on this podcast and lose and almost get labeled bulimic and get put it anorexic and get put into these institutions where they have to go through recovery from being anorexic. Why do you think, what's the interaction between the Lyme bacteria and these weight disorders that people put on? I'm just curious if you have any guesses as to why Lyme triggers that.
It's interesting because my experience has been just the opposite. I have not had too many patients who had issues with weight loss. I would say the vast majority of the patients that we were dealing with, were having a lot of issues with putting on weight. Weight was the big issue. And some of it was true weight. Some of it was just fluid retention, but I'm talking about significant fluid retention. But I'm trying to think of, any patient that, the problem was that, they were losing significant amounts of weight. For us, it was always, again, there was some patients who were hyperthyroid and they were uncontrolled, and so they were losing weight. But once you corrected their thyroid issue, the weight was no longer a problem. But the vast majority of patients, the issue was always weight gain. Always.
What do you think was causing the weight gain? Was it hypothyroidism?
Oh yeah,
was
absolutely.
it another mechanism?
Yeah, absolutely. Hypothyroidism was the main cause. Slowed metabolism, and a lot of, but even with the hypothyroidism, okay. A lot of patients who were hypothyroid, once we treated their underlying problem, their thyroid, started reverting back to working normally. So they did not have to take a thyroid replacement.
So when you address the underlying infection, you're saying that the thyroid resolved itself.
Yeah, again, it's inflammation. You get inflammation, hypothalamic pituitary dysfunction that triggers, a thyroid dysfunction. Not enough thyroid or the wrong type of thyroid, and the patients would begin to, even, with being, calorie restricted, being physically active. Their weights were just going up, and obviously, that's certainly, incredibly frustrating because you're doing everything that you've always been told to do, and you yet continue to gain weight.
Do you have any thoughts as to what the interaction is between the Lyme bacteria itself and the human body that's causing this change in behavior? So we know Lyme is likely causing this reaction, but what do you think it's doing chemically in our bodies to trigger this, right?
I think it's just an inflammatory reaction, and the inflammation will affect the hypothalamus, which obviously controls the pituitary. And so, then you get pituitary dysfunction. And so all your hormones, essentially your adrenals, your thyroid, in women, their ovaries, everything, the parathyroids, everything begins to malfunction. But it's all secondary to the effect that the bacteria has on the hypothalamic pituitary axis.
So before I go into the next question, I just want to point out, you're in, I believe, El Segundo, California, correct? So you're in California.
Correct.
And you were finding that the majority of your chronic fatigue syndrome and fibromyalgia patients had Lyme disease in California, where people believe Lyme doesn't even exist, right? Which is kind of mind-blowing to me.
Oh, no. Well, as you know, I think every state, except for Alabama, has reported Lyme, okay? So I mean, yes, I mean and it's not just the United States. I mean, obviously Lyme disease has been, reported all over the world, and in terms of, I mean, the number of phenotypes of Lyme, 300 worldwide, 102 in the United States. I mean, they've isolated Lyme in birds. Birds migrate, so God only knows, what else we have to deal with. So I mean, it's everywhere. I mean, I mean, what is it? 2 years ago, I mean, there were 600,000 cases of acute Lyme reported. Okay, I mean, is it possible that just 3 or 4 states, could account for that number of Lyme patients? No, I mean, every state, like I said, except for Alabama, and I don't know why Alabama insists that they've never had a case of Lyme. But every state has reported Lyme. Every single state.
Well, all right. So then that brings me to my next question, which I kind of took a pause to focus on that. But when you're talking about inflammation causing a lot of these changes in the human body, one of the things we hear from our female patients, female guests on this podcast, is that oftentimes they have really severe menstrual cycles, they have really bad endometriosis, and many of them have these really severe surgeries to get relief, and they simply don't until they get the Lyme under control. What are your thoughts on that too, when it comes to the feminine reproductive system and all the issues you're seeing, or if you're even seeing these issues like we are with endometriosis, et cetera, and Lyme?
Yeah, I don't, I mean, I'll be honest with you. I mean, I don't see too many cases of endometriosis. And most of the patients, most of the women patients that I see, with Lyme, usually perimenopausal, menopausal. I have very few young patients. I mean, they may have a lot of PMS, but I really haven't had too many patients who have been experiencing a lot of endometriosis.
So let's talk about your use of, because I feel like you were using some of these tools before you got into the Lyme space, but I think you're still using them as well. This bioidentical hormone replacement therapy. Can you just simply explain what that is for our listeners in simple terms, and how you used it and how you are now using it in the Lyme community?
Again, with Lyme, and we do see a lot of hormonal disruption, and so it's a question of replacing, but again, we're trying to, by bioidentical, we're talking about our hormones that mimic what your body produces. Okay, they're not synthetic, they're not produced in a lab. Okay, they're essentially the same hormone that that your body is producing, and so we feel that patients respond to bioidentical hormones better than they do to any synthetic hormone. Okay, in terms of the thyroid, I mean, with the thyroid, it's a whole different issue, because most of the time people get, they get replaced with the, T4, but that's not necessarily the best way to do it. With women, it's, estrogen and progesterone, with men, testosterone. But again, it's all, it's just that in a lot of this hormonal, abnormalities, okay, are not necessarily things that they're going to continue to experience once we get control of the Lyme. Okay.
Yes.
And many times when we finally get a handle on the Lyme, we find that they no longer need the hormone replacement. Obviously, there's an exception with women as they get close to menopause, or they're menopausal. I mean, and they're having symptoms secondary to menopause. That's a whole different, but that's a whole different subset of patients. Okay. I mean, their symptoms are not secondary to Lyme. They're secondary to the fact that their ovaries are shutting down, and they become menopausal, and they do develop symptoms. Okay, but in terms of adrenal dysfunction, in terms of thyroid dysfunction, I mean, those kinds of things, a lot of times we find that once we get the Lyme under control, they no longer need the hormone replacement. They're perfectly fine. Their organs begin to function normally. They produce the right amount of the hormone, and they don't need to be supplemented.
But I wonder if this is a good tool to use while you're treating, because if you are experiencing severe symptoms of Lyme disease and you're undergoing treatment, can this tool be used, right? Can bioidentical hormone replacement be a helpful therapy to balance your hormones while you're treating, right? To give you
absolutely. Absolutely.
Right?
No, absolutely. And yes, we I mean, I would say the vast majority of patients, that we treat for Lyme, okay, do need hormone replacement. Okay, and they do need thyroid, and a lot of them need a lot of adrenal support. So no, we definitely use hormones, treating patients, while we're trying to get control of their underlying problem. Sure, there's no question about that. Absolutely, yeah.
Because I also wonder, hormones, and correct me if I'm wrong, Dr. Laufer, but I feel like hormones will impact your emotions because they're really chemicals that impact how you feel. And if you aren't in a good emotional state, you may not be making sound decisions to treat yourself, right? Or find a good doctor to partner with. And I can tell you,
absolutely.
I mean,
Hormones can affect your sleep, can affect your
yes.
cognitive function, can affect your gastrointestinal function, can affect your level of fatigue. I mean, absolutely, there's no question about that. Hormones have a huge impact.
I mean, I'm really grooving on this because Dani, you tell me. I know I was stuck. Well, I know your journey is not, for me, I was stuck for many years because I was so afraid. I had these emotions of fear that I typically didn't have before. And I think my hormones are all out of whack. And if I was able to find a doctor like Dr. Laufer who can help me manage my hormones, I would have made more logical and rational, sound decisions to expedite my healing journey. And we don't talk about this enough, where our emotions are different because of Lyme disease, because of our hormones, and therefore we don't make sound decisions. Can you relate to that, Dani? I think it's a very common theme we see, and it's really interesting to think about it that way.
I mean, I would be very surprised to hear that physicians who actually treat patients with Lyme do not address their hormonal abnormalities. I mean,
you'd be surprised. We've had a lot of doctors on this podcast, Dr. Laufer, and not many of them talk about using hormonal therapy or that approach. Yeah, I mean, we've had people say they recommend herbal therapies that can help calm down the nervous system and teach you how to fight or flight, but nobody's ever said specifically, I need to get your hormones under control. And that's an important fact. So that's why I'm harping on this, because nobody's gone this deep about it with us on this podcast.
I'll be honest with you, I'm shocked. I truly am shocked. That's one of the first things that you address. Okay. I mean, and once you get their hormones balanced, then everything else, then you address everything else. But that's certainly something that you have to address. I am surprised. I truly am surprised. I assume that everybody who treated patients with Lyme or chronic fatigue or fibromyalgia, one of the first things that they would do, would be to assess their hormonal function and deal with any abnormalities and correct any abnormalities that were presented. I'm shocked. I truly am.
Yeah, well, we've put together, we had over 350 people on this podcast, from patients to celebrities to researchers to doctors to advocates, you name it. And Rich and I put together this framework that we call PARM, and PARM is an acronym, PARM, and we find that it's sort of a 4-staged approach to healing. And we think like prehab comes first before you actually do any of the killing. And prehab, I think, would be like hormonal therapy, allowing yourself to detox, getting yourself in a good place with your emotions. And then we then go into the assist phase, which is assisting your body and your immune system in killing the bacteria. That's more of the kill phase. And then the rehab, you have to kind of help your body rebuild from all the damage. And then the M stands for maintenance, where you have to have a different lifestyle to prevent a relapse or getting reinfected or being susceptible to some other illness down the road. Do you think that's a good model? Do you have any feedback for us in that model?
Yeah, no, I think that's perfectly reasonable. Absolutely, yes. I mean, I think that's pretty much the model that we follow. Okay. I mean, I think it's legitimate. It's logical. And so I'm frankly shocked from when you tell me that some of these things are not addressed. Okay, to me they're common sense. They just maybe they're just looking for the wrong thing, or they're assuming. But I'm as you can tell, I'm kind of speechless here. I don't know what to say.
Well, help us out, because we need more information to help our listeners. So what are some tests you run to help identify what hormones are not in balance, which then guide you to identify what hormones need to be balanced through this bioidentical hormone replacement therapy?
Well, you started with the simplest one, the thyroid. Okay. I mean, I say simple, but obviously the thyroid is essential for life. If your thyroid is not malfunctioning, you don't have the hormone, you will pay a price with your life. But it's in terms of what you test for the thyroid. Okay. Most physicians, when they test for the thyroid, they do a TSH, and that's it. If your TSH is below 5 or below 4, then you're fine and there's nothing wrong. Okay. But that's the wrong way. And the TSH has been, we know that it's a highly unreliable test for thyroid function. I mean, so you have to look at, the T4, you have to look at the T3, but more importantly, and this is something that not too many people look at, is something that reverse T3. Okay. And reverse T3 is something, it's the way the thyroid works, you have, the pituitary, which releases TSH, which stimulates your thyroid to make hormone. Your thyroid makes T4, which is only about 20% as active as the active hormone. The active hormone is T3. So T4 converts to T3, but T4 also converts to reverse T3. And reverse T3 has no metabolic activity. It doesn't do anything except it binds to the same receptors that T3 uses to get into your cells. So if your reverse T3 is really high, even if you have circulating thyroid, if it's not getting into your system, it's not doing you any good, okay? The other thing that people, disregard is the fact that the conversion from T4 to T3, most of that conversion happens in the gut. So if your gut is not working well, your thyroid is not going to be working very well, okay? And so in most of the patients that we have, reverse T3 is incredibly high, because it's really a way of your body to try to protect itself. So you have to get rid of that reverse T3. And the only way to do that is by giving you T3, okay? You take T3, there's less T4 produced, less T4 converting to the reverse T3. The reverse T3 gets absorbed. The stuff that you already have in your system, it's an organic molecule, gets absorbed, and all of a sudden those receptors open up and the thyroid actually begins to get into your system, okay? Now, the other, then you have your adrenals. If your thyroid is not working well, then your adrenals are trying to compensate, okay? But then they get to the point where they can't compensate anymore. And then you start becoming symptomatic because of poor thyroid function and poor adrenal function. And so it just makes you more fatigued. You're less able to deal with things. Anxiety, stress becomes more of a problem. Your ability to deal with stress and anxiety becomes problematic. So you have to balance, you have to take care of the thyroid, but then you have to take care of the adrenals. And a lot of doctors, they hesitate to treat the adrenals, okay? They're concerned, if you take too much cortisol, you're going to shut down the adrenals, and then that's going to create more problems. Yeah, but again, if you go above a certain amount, then that will create a problem. So if you go, above 20 milligrams, let's say a day, then it's obviously, it's going to be very difficult to get you off. But I have seen so many patients who, they're having terrible fatigue, they're dizziness, lightheadedness. They're terrible cravings, salt, sugar, they just can't function. And then you do small amount of, replacement for their cortisol, and it changes their lives. Okay. All of a sudden they're able to function. They're feeling better, less fatigue. They're able to do things. Okay. And then, testosterone becomes an issue. Okay. And, testosterone, it's not just about sexual function. Okay. Obviously it's an important part of sexual function, but testosterone plays a role in motivation and drive and concentration and focus. It's an important hormone. And again, if it gets compromised, then, you have to do something about it. There's a couple of ways of approaching it. You don't necessarily have to do just, the testosterone. A lot of times, again, because of this hypothalamic pituitary dysfunction, your LH, luteinizing hormone, becomes compromised. Okay. So it doesn't respond, to low levels of testosterone. So if your testosterone levels are very low, your pituitary should respond by releasing LH, luteinizing hormone, which increases the production of testosterone, okay? But sometimes that doesn't happen. And so you don't necessarily have to take testosterone. You can take something that mimics LH. And by doing that, you get production of testosterone, okay? So these are things that, certainly anybody can do. If you just have to do the testing and not, it's important to get the patient to be more functional. That is the key. And again, if your hormones are not balanced, your immune system is not going to work very well. So all these things are very much interconnected. Okay. And that's what you have to understand. Nothing in your body works in isolation. Everything very much interconnected. And so that's the way you have to approach it.
Well, I just find this fascinating. So you told us, and we know that these hormonal imbalances are a downstream effect of an infection from Lyme disease, but you address that first to bring symptom relief. But I think it's twofold, because in the prehab phase of your healing journey, not only are you using this hormonal replacement therapy to bring more, a quicker symptom relief to the patient while treating for Lyme next, but I think it's also allowing for a more hospitable place to heal, because when your hormones are not balanced, it causes chaos in your body, and your body is less able to heal, right? So I think it's twofold. You want to bring more quick relief to the patient, and you also want to make the body more able to heal. And
Absolutely.
So you have to balance the hormones first before treating, so that the body can better receive the treatment, right? So it's really multifaceted.
Absolutely. And again, if your hormones are not balanced, besides the inflammation, they will have an impact on your immune system's ability to function. Okay. So anything we can do to improve immune system function, anything we can do to decrease inflammation, I mean, certainly, and hormones play a big role with that. And so that certainly has to be addressed. No question about it. Again, I guess I'm living in a bubble because I assume that everybody does that, you know.
Dr. Laufer, I can tell you that's not the case. So I'm
Then
happy you're sharing
I
this.
am living in a bubble. I'm sorry to say. I
Well,
find
we need to pop that bubble and
No,
expand your knowledge to everybody across the world.
I find that incomprehensible. I truly find that incomprehensible. I'm flummoxed that you tell me that there are people out there who simply, you know, take a couple of, like herbal, just over-the-counter medication that's going to take care of your hormones. That's absurd. That is totally absurd.
Well, I can tell you, I used it. So I didn't see a Lyme specialist when I first got sick. When I first got sick, I had debilitating Lyme disease, neurological Lyme disease. I was severely impaired. I was a shell of the person. I had the cognition of a toddler. I mean, I was barely able to speak. I couldn't drive. I was fainting. I was off balance, you name it. And they gave me IV antibiotics, and I was in a constant state of fear. I never had anxiety prior to that. My hormones were a complete mess. And I saw some of the leading infectious disease doctors in New York. Yeah. And all they did is give me IV antibiotics. That's going to cure your neurological Lyme disease, right? Nobody brought up hormones. And I was constantly afraid. And I was telling my doctors, I'm afraid. I'm worried about everything. I've never had anxiety before. What is this feeling I'm feeling? I feel like I'm a different person, but it was never brought up. So especially if you're treating in the mainstream medical community, you're not going to hear this. And a lot of Lyme doctors too sometimes gloss over this topic. So I think it's really important that we're talking about this. I don't want to, I can't emphasize it enough.
I am in a state of shock when you tell me. I really cannot comprehend it. I truly cannot comprehend it. It's such an important part of the approach to treating patients with Lyme, that I assume that everybody, this was a no-brainer. This is the first thing that you address. You make sure that the hormones are balanced so that then you can go forward and address everything else. I assumed everybody did that. I guess I was wrong.
Well, we always knew, what we've learned from this podcast, that and I think a misconception is a lot of people think I just want to jump right into treating. I want to kill this bacteria. It's making me so sick. We've learned that that's a mistake. You have to do some things first before you jump into an aggressive kill protocol.
Yeah, if it was that easy, then everybody would be doing it. And then after a few weeks, everybody would be perfectly fine. And then life goes on.
But that prehab toolbox we looked at as nervous system regulation, opening up your drainage pathways, helping support your liver, helping support, your organs and your gut health by taking probiotics and maybe some berberine and things like that, herbs to really help support your gut. But we really never focused on the hormones. So you're giving us a piece that we haven't heard this much about. And I think it's really important to note. But so is there, I feel like there is, and maybe you can help us explain in simple terms and then expand upon that, the relation between our hormones and our nervous system. So, we all know we have fight or flight, which means, we're stuck in, aggressive mode. We're stuck in, we can't make a decision. We're stuck in fear. And that's really the one side of the nervous system. The other side is more the rest and digest, which is the homeostasis, the balance side. And many of us get stuck in that fight or flight. Is there a correlation between our hormones and our nervous system? And do things like HPA balance and adaptogens and those types of herbs help us with our hormones as well, in addition to hormone replacement therapy?
Of course, no question about it. HPA balance and any kind of adrenal supplements, can be a huge help. There's a lot of times, when patients are dealing with severe anxiety reactions, the immediate reaction is take a couple of pharmaceuticals and that's going to take care of it. There's a couple of hormones that have been found to be very effective in terms of relaxing patients, something like oxytocin or pitocin. Even men have found it to be very effective in terms of kind of down regulating their fight or flight reaction, their anxiety reaction. And obviously, when you do something like that, there's no potential for addiction. There's no potential for any significant side effects. So yeah, I think it's, and I think you can't disregard it. Okay, I think it really is important. Now, a lot of times with Lyme, as especially with the I'm blanking, with Bartonella, okay, you tend to have a lot of central nervous system issues, a lot of neurologic dysfunction, I mean, it really makes you incredibly sick. Okay. And so, I mean, in those kinds of situations, it really is more important to try and kind of, bring down the brain inflammation, trying to reduce, the reaction in the hypothalamus. And so there again, there are hormones that can be very beneficial. There are supplements that have been found to be very beneficial. Okay. There are peptides that have been found to be effective as well. And again, the advantage of doing any of those things is that, number one, they're not going to cause you any significant issues. Okay. I mean, negative issues. Okay. They're not addicting. Okay. So you don't have to worry about, my God, you put me on Xanax and then, I'm not going to be able to get off Xanax, for the rest of my life, and I'm going to be dependent on it. Okay. Which is sometimes can be a problem. Okay. I have found that, things like, CBD, CBD with THC, can be incredibly helpful. Okay. I mean, and I've had a lot of patients, who respond to that, beautifully. I mean, it relaxes them. They sleep better, less like acute anxiety reactions. They deal with stress better. And I certainly prefer doing that than giving patients prescription medications. Okay. Which invariably, will cause problems, and then we have to get them off. They have to be weaned off, and sometimes unsuccessfully. So I mean, I like to choose natural forms of therapy rather than prescription medications if I can avoid them.
So can you define for us, Dr. Laufer, hormone versus supplement, right? Because you're saying like hormone replacement therapy is a really effective tool, and that's how you can get hormones under control and balance things out. But then you said also supplements are very helpful. So to me, supplements are herbs, things from the earth, like ground up herbs, right?
That's exactly what it is. Yeah, it's just herbs that have been known to to have certain effects, and it's either one or a combination of herbs that can be very effective. Yeah, so supplements can be very beneficial. I mean, they do have. I mean, I have found supplements, in terms of, let's say, for patients who have issues, with adrenal dysfunction, to be very, very effective, and I don't have to give them cortisol. Okay. I mean, I have patients who, severe anxiety, and I have found, herbal medications that can, certainly not necessarily completely control, the reaction, but certainly make it much more manageable. Okay.
Can you give us some specifics? What specific herbs do you use to treat various things that you just described?
Again, we have, Holtorf has designed a bunch of different things, and that's what we use mainly here in the office. Okay. I mean, so it's a combination that most of them are combinations of herbs that we have found to be effective. So that's pretty much what we use.
Okay. Well, I do want to ask, because I know there's a couple of things here, and Dani, feel free to jump in. I know you had an internet connection earlier, so I want to let our listeners know.
She can't jump. It bothers her, so she can just sit down and bring him up.
All right, you can feel free to just yell over me, Dani.
That's it. That's it.
Some of the things that we're addressing right now it's just such an important conversation that we're having, because obviously in the community, gaslighting is a huge thing, and there's really no separation between like what could be seen as like mental illness or all these other, things that aren't a reality of the situation, when it's these exact things we're talking about, this like hormone dysfunction, these adrenal problems, which is why I felt so fortunate that my journey started at Holtorf, because I've heard from so many other people that they go this other route, or they see so many other doctors and they can't figure out what's wrong. And that was the first thing. The second that I came to Holtorf, immediately Dr. Laufer was looking into my thyroid, into my adrenals, like just based on symptomatically what I was going through, which I had already seen starting with a GI. The first person who told me, you're crazy, you need to see a psychiatrist, it's all in your head, there's absolutely nothing wrong with you, which, as we know, to this day, I still have extreme gut dysfunction. So that was very but I think just as a broader topic, this is so what you guys are discussing. I was trying to jump in here and there, but I know you guys are on a roll. But as a patient, as a listener, this is so important. Me personally, I take for granted the fact that Dr. Laufer shined a spotlight, and that was sort of the first place that he started digging. And that's something to ask you, Dr. Laufer, because Matt was saying that sometimes these like adrenal and hormonal issues are like a downstream effect of Lyme. My understanding of my personal story is, I was kind of going along my life being fairly healthy and active and okay. And once I started, thyroid condition is something that runs in my family, and hypothyroid was something that started occurring. And that's when I started feeling those symptoms of those hormonal imbalances, adrenal, issues. And nobody for years was able to help me, give me a thyroid medication and just help me to balance my thyroid and to address very simple issues. To my understanding, is what triggered what would be considered my chronic Lyme. Now, I know there's never a perfect pinpoint accurate description of how chronic Lyme can be triggered, but for me personally, along with stress and other things, that's kind of what happens. So is that something that you notice in a lot of your patients, is that having this onset of a thyroid issue or adrenal issue can trigger chronic Lyme?
Of course, there's a lot of triggers, and certainly that could be one of the triggers. But
What
most of it, I'd say that, certainly, 90% of the time there is a trigger. Okay, there is something, either stress, some kind of, infection and you just never recover, some major trauma, surgery. There's always a trigger. Okay. And that's something that we do find. Okay. And again, I am really flummoxed. I believe that everybody, one of the first things that you would do is check, for hormones and make sure that your hormones were balanced, to eliminate that as a potential source of whatever symptoms that you're experiencing, and just get those under control, and we don't have to worry about those anymore, and then we can go on and do everything else. So for me, this is an eye opener. I truly am still in shock. I mean, that's why I keep bringing it up, because I can't believe it.
Yeah, I feel like I'm a rare phenomenon, so I'm on the same pathway with you. Well, I first saw you in April of 2019, and I was hysterical and completely non-functional. So I think that's probably why you looked at my adrenals right off the bat.
To me, that's a no-brainer. I mean, I'm sorry. I just don't. I find it difficult to reconcile myself to the fact that some people don't look at that right away and get that out of the way. That's that's something that you can correct. It's I mean, it's not going to interfere with anything else that you're doing, and you get that taken care of, and then you can go on to do other things.
Yeah.
But again, a lot of times, if you ignore the hormones, okay, and then you start on certain therapies, I mean, the patient is not going to respond as well if their hormones are not balanced versus when they are balanced, and then you can do certain therapies and the results are going to be much more satisfying. But if your adrenals are totally off and your thyroid is totally off, and then you start treating, the response is not going to be very very good, okay, or not very satisfactory. I mean, to my way of thinking anyway. So I just don't understand it. I truly don't understand it.
I just think it's so helpful for a lot of the listener or new listeners or people who are struggling right now, because in the general spectrum of treatment that you would get from your GP or whatever, I know me specifically, I don't even know if you know this, Dr. Laufer, but my general doctor just told me, if you lose some weight, you'll feel more attractive, and then you won't be so emotional and you won't be dramatic, and those types of things. So I sought out at least a GI doctor, because I thought, well, at least we can start there, who told me I was crazy. So I went to a psychiatrist who, interestingly enough, did prescribe me Xanax at the time, which I felt really uncomfortable with because I wasn't educated in it and so on, like as what you were speaking to earlier. And what's interesting is, by the grace of God, I was brought to your office and found you, and you were a perfect fit for me. I'm
telling you, Dani, I'm in shock. I'm not kidding you. Okay.
Well, what's interesting is
Oops.
Oh, Dani, I think Dani cut out. Just so our listeners know, Dani was trying to speak earlier as well, and she totally froze out on us. So I apologize for the technical difficulties. We're happy that Dani was able to participate this far. So, Dr. Laufer, I'm going to just follow up because I hope Dani does come back. She's still in the meeting.
She's still frozen. She's still
frozen. But let's expand upon the term nutraceutical. We've heard this term, and it sounds like a fancy term. Can you just describe, because you did this also before learning about Lyme disease, what is nutraceutical therapy, and how and are you using this today for Lyme patients?
Yeah, we do. Okay. again, it's trying to find alternative ways of treating pain, trying to avoid, a lot of prescription medications, which potentially can create, more significant, more significant problems. Okay. I mean, most prescription medications invariably, potentially can have side effects. Okay. Which would only, go to make the patient's symptoms worse. So we try to avoid those things. Not to say that, herbs or nutraceuticals don't potentially have, can create issues as well, but the likelihood that they will is significantly less. Okay.
What is a nutraceutical? Can you? I'm still confused on the term. So, what is it? Food? Is it a pill?
Yeah,
what exactly is it?
It's usually plant-based therapies. Okay, most of the time it's plant-based. Okay, I mean they're chemicals that are derived from plants. Either plants, foods. To treat certain conditions, and that really is essentially what it means.
So if I take an herbal supplement, like for example, I take the Dr. Roll's Restore Kit, right? Is that a nutraceutical because it's filled with plant medicine?
Yeah, that would be considered a nutraceutical.
Natural food that
derived from a natural product, not synthetic, not created in a laboratory. I mean, but just extracted from natural, from natural foods, for specific functions that they could have. Yeah.
And we know a lot of these herbs have antimicrobial properties. So for example, Japanese knotweed, right? We know a lot of these things have been proven by Johns Hopkins to have stronger antimicrobial properties than some antibiotics, right? So I think you're targeting, it sounds like we did at Holtorf, is you built this nutraceutical line based on the most potent herbs to address Lyme and tick-borne illnesses, and you bundle them together in a blend, and that's the nutraceutical you're now offering to your patients, correct?
And you're less likely to develop resistance, to this, to natural things than you are to chemical things. Okay, I mean you're not going to you're very, very unlikely that you're going to develop a resistance to any nutraceutical that you take. Okay, I mean so that's certainly an advantage.
Let me ask you a philosophical question, because Dani was asking you earlier about the her hormonal issues triggered the chronic Lyme, right? But, we hear this in the autoimmune community a lot as well. People have autoimmune disease that they have in their family predisposition to. They have other pre-existing conditions. And do you think that the tick bite and the infection from the tick triggers your genetic expression to activate the whatever it is, autoimmune or thyroid issue? Or do you think that those other conditions activate the Lyme and make it so severe, which is why some people are more severe than others, Let
me just say something, okay? I mean, for when you're thinking about autoimmune diseases, okay? I mean, there's a couple of tests that you do, okay? In a number of patients who have Lyme, who have any chronic fatigue, it'll come back elevated. It's positive, okay, suggestive of some kind of either lupus or Sjogren's or something like that. But in reality, a lot of the times, this test will turn positive simply because of inflammation. Okay, and I've had a number of patients, okay, that we test them and they come back with their anti-nuclear antibody is elevated. Oh, right away. I mean, they have lupus. But we treat him, and then 6 months later, we repeat the test, and it's totally normal. So inflammation can trigger that kind of a reaction. So it's not necessarily an autoimmune condition. Okay.
So do you believe that the Lyme triggers the inflammation, which mimics the autoimmune disease in many cases?
Correct. I mean, the Lyme will trigger the inflammation. There's no question about it. At least in my mind.
In Dani's case, do you think the Lyme triggered the inflammation, which triggered her, thyroid issue, which was in her genes to begin with from her family? Like, what's your thought on that scenario there?
Again, it remains to be seen. And the goal, if once we get her, functioning, totally well, then we may find that her thyroid is perfectly fine. Okay, and again, it's something that I have seen. I have seen many patients, believe me, who we treat the Lyme, we treat the adrenals, the thyroid, we treat the adrenals, we treat everything else. And then once we get control of the underlying infection, the inflammatory reaction subsides, they will recheck all these numbers and the patient's perfectly fine. They don't have to take anything.
I just want to highlight for our listeners, your mission, right? Because I think your mission statement is really powerful, and it's exemplified by what you're describing here, that your mission is to provide the latest research-based treatments and the safest methods for improving the quality of life of your patients. And that's what you've been describing this entire time. And you utilize these cutting edge tests and innovative treatments to uncover and address the root cause symptoms. And I just so appreciate your honesty about, some things we just don't know, and we'll know in time. And, there is so much we still don't know, but there is a lot we do know. And you've used your 40 plus years of treating medicine to make pattern identifications to shortcut your patients' journeys. And I think over time, we're going to continue to build upon that and be able to make even more progress than we can today. So it's really just inspiring to hear all this. I just want to take a minute to kind of let you know that you are providing a lot of hope to our listeners, and you have a lot of great.
I like to think that I do. Okay. Maybe I'm just, kind of fooling myself, and I think I'm doing a lot more good than I think I am, but ultimately that is my concern, is to make my patients function. Okay. I don't want them to just exist. I want them to live. Okay. I mean, it doesn't do any good, just, get up in the morning, sit in front of the couch, and then watch life go by. Okay. I mean, you have to be able to participate. And that is my goal. My goal is for them to get their lives back. Okay. Not exist, but live. Okay. And I mean, it may sound trite, it may sound idiotic, but ultimately that is my goal. Okay. That is what, and again, like I told you before, I have some patients that I had not been able to do a damn thing for. Okay. And believe me, I have tried, and they just don't respond to anything. Okay. And it's not because they don't want to respond. Obviously, they want to get their lives back. Okay. And it's incredibly, incredibly frustrating. It truly is.
But see, you are so passionate, and I appreciate you, and we appreciate you. Dani and I appreciate you being so honest. But I want to make the argument that 14 years ago, you couldn't help the patients that you're helping today because you've learned as an individual. And I think collectively as a society and as a medical community, we are learning and growing as well. So the patients that feel like they are left behind, that they can't get better, that doesn't mean there isn't hope in the near future for other medical discoveries and breakthroughs to help them, right? So I just want to put that point of hope out there, because we've seen it on this podcast. We have. But
there's one thing, if there is I guess if there is a silver lining, because from the pandemic, okay, from COVID and the long COVID patients, okay. I mean, the fact is that long COVID patients present very much like patients with Lyme, like patients with chronic fatigue. I mean, this is what they had an infection and they had an inflammatory reaction. The reality is that there's a lot of money being spent now on research for long COVID, okay? Which invariably, I mean, I really feel very strongly that in the next year, 16 months, I mean, there will come up, and I'm not talking about coming up with medications, prescription medications, but with finding different systems that are affected and how they can be impacted to improve a patient's life. Okay, and I think the research that is being done on long COVID is going to eventually have a huge impact on the Lyme population. I really believe that very strongly. And so we're not standing still. I mean, there's things that are continuing to be researched. Again, with Lyme, I mean, everybody's got something that they do. I mean, Horowitz has this this new antibiotic protocol that unfortunately most people can't tolerate. As I mean, people were using antiviews, disulfiram, to treat Lyme, but nobody could tolerate it. But again, at least we're trying, okay? And that's the important thing. The important thing is not to give up, okay? Not just to simply say, well, I mean, there's nothing we can do. You're just going to have to live your life and, don't bother me anymore, okay? You have to keep trying. I mean, there's got to be something that you can do. Even if you improve somebody's life by 20, 30, 40%, I think even that is significant.
Couldn't agree more, Doctor.
I just wanted to ask too.
Dani, you're back.
Can you guys hear me?
Yes, you're
froze
back.
Before.
All right.
You froze.
I'm sorry, fellas. Well, just from the patient perspective, Lyme, it's the way you're speaking about it, Dr. Laufer, it's almost like a spectrum, right? Because everybody who is battling Lyme disease, chronic Lyme disease, it's such a wide spectrum in terms of how to treat it or how long you might have it or get into some kind of remission. Or I feel like that part of it is so difficult to explain to like family, friends, people that you work with, significant others, all of those things. So I was kind of curious, like how would you go about explaining that to somebody? Like if somebody first came in your office and had no idea about Lyme. And this really goes back to when I was asking about the triggers, because in my story recently, I had a friend of mine, I've kind of become an advocate like on Instagram and social media, and I share a lot of my story. And a friend of mine found a tick on his leg. And because of seeing my Instagram, of course, he panicked because he knew me when I was well and traveling the world and teaching and living this like great life. And he sees me now in my wheelchair, even
Right.
though I'm doing much better, because my story. For him, he just sees that. So that's why I was asking about triggers and if there's any possible prevention to getting to that point where it's chronic. But even in that, for people to understand the spectrum of what chronic Lyme looks like, how would you even describe that to somebody?
You can. I mean, and the first thing the patient has to understand, especially with somebody who's got chronic Lyme, that it's a process. Okay. I mean, there's no quick solutions. I mean, there's no guarantees that anybody's going to respond. So the first thing that they have to understand that it is a process. It's a long road. And it's unpredictable, and there's no way of being able to decide, what they're going to respond to, what they're not going to respond to. Okay. Now, the other thing is, as you know, that a lot of patients who have Lyme, who end up having Lyme, they don't remember ever getting bitten by a tick. And it's not just ticks. We're also talking about horse flies and mosquitoes. Sometimes there's some guy in Pennsylvania who thinks even gnats can transmit the disease. We know that anecdotally we know that it can be transmitted sexually. It can be transmitted from mother to child. I mean, in the womb. I mean, so there's a lot of ways of transmitting this disease. But a lot of people simply they have no idea. They don't remember ever getting bitten. They never had a reaction. They never had a rash. I mean, nothing. Okay. And then it comes as a total surprise, as a total shock. And so, but again, they have to understand that it is a process. Okay. I mean, now the one thing that I would recommend, though, if anybody who gets bitten by a tick, I mean, I don't care, if they don't get a rash, I would treat him. I would treat him with 2 antibiotics. I would treat him, for at least a month. I mean, I'm not taking any chances. I mean, maybe I'm being overly aggressive, but I would rather do that than have them, have to pay the potential price of developing, chronic Lyme and have them impact their lives in such a profound way, So that's my take. That's my take on it, and again, everybody has different takes on it, but again, the important thing is, people have to understand it's a real disease. They're not imagining it. This is not a figment of their imagination. No, going to a psychiatrist is not going to take care of their problem. It is not in their heads. There are, significant issues, physical issues that have to be dealt with. And if they're not going to get better. No matter how many anti-anxiety medications they take, how many antidepressants they're going to take, it's not going to do them a damn bit of good. And unfortunately, there's been patients who, have done away with themselves because they simply see no hope, and they despair, and I think that's totally unfortunate. I just think it's a tremendous loss, and it's an unnecessary loss.
Do you think though that? Oh,
Yeah.
sorry, Dani.
I was just going to say, I appreciate you so much explaining that. Obviously, Matt and I know that, and some of us that are further along in our journey have experienced it, but I just think people just really have no comprehension of any kind of understanding of this disease. And so to hear it from you and just being so honest about it, I appreciate it.
I mean, for me, it defies explanation how some people, can actually, conceive that somebody, complains, can't get out of bed, can't function. I mean, going to the bathroom is the equivalent of running a marathon. How they can conceive that is really what somebody wants to, that's how somebody wants to live. Okay. I mean, nobody imagines that kind of, those kind of symptoms. Okay. I mean, I think it's absurd. But again, some people, that's how they feel. It's all in your head. There's nothing wrong with you. The other problem with Lyme, and it's, I mean, testing and treatment can be costly. Okay. And that can be a problem. I mean, that can be a huge, huge problem.
That's something I wanted to ask you too, Dr. Laufer. I mean, obviously the Holtorf office is located in Southern California, but you've trained so many doctors, and I'm sure you've experienced, being many places, but why California? First of all, do you choose to be here? And secondly, thank you, because there is not a lot of support here at all.
But Dani, the reality is, I mean, yes, I'm based in California, but I literally, and I'm not bragging, okay? I mean, I take care of patients in every state of the country. I have patients in England. I have patients in Canada. I have patients in Kuwait. I have patients in Spain. I have patients in South America. So I don't limit. I mean, obviously, we treat, we do things differently because, obviously they can't fly in every time, but no, I mean, I treat patients because, again, people, they can't find somebody to address their problems in whatever community they live in. And so they're searching. And I can't, I mean, I think, I have patients in Australia. I have patients, all over the world, and it's unfortunate that they have to resort to seeing me and not having someone in their own communities. But that's the reality that we're living with at this point, unfortunately.
That's always a surprising things to me, that like I'm here in Los Angeles and there's no support really for the Lyme community here. There's some in San Diego, which is Southern California, but other than that, I mean, it's Los Angeles. You would think that there would be.
But Dani, remember, there's still a lot of physicians who, deny the existence of Lyme.
Right.
Chronic Lyme is a figment of your imagination. Chronic Lyme does not exist. It's if you wanted to get better, you would get better. Just put on your boots and get on the, just go function. And if you can't function, go see a psychiatrist. They'll give you an antidepressant, and that'll take care of everything.
Yeah. Well,
I mean, it's the unfortunate reality. I mean, that's the unfortunate reality.
And what happens if it's not treated? If somebody, is not able to get that kind of support or help, or is this something that like progresses to the point of where symptomatically can kill you? It's not like we would technically maybe die from the Lyme infection, but
no, you're not likely, you're not likely to die, but you certainly would become totally non-functional. Okay. But again, and it gets to the point where you're so non-functional that what's the point of living? And I mean, a number of patients, have in fact, taken the ultimate step and they've done away with themselves. Okay. Which is unfortunate, but again, that is just desperate. And again, part of it is also that, they're non-functional, people don't recognize that it's not something that it's not a problem of they're unwilling, or, they're not willing to, they don't want to get better. Okay. And a lot of it also has to do with family support. A lot of families simply do not accept that, there's anything wrong. They all, get out of bed. If you wanted to, you could, this is nonsense. Just get out of bed. But, you can't, and they don't, and so they don't get the, that kind of intimate support that I think is absolutely necessary. I think people have to recognize that, the vast majority of Lyme patients, given an option, they would want to live their lives. They don't want to be, in bed, or they don't want to be at home all the time, unable to function, unable to, mentally. Everything is, they're going through pea soup because they can't think. They just can't generate two thoughts together. Nobody wants that. Obviously there's some people, but nobody really wants that. And so that's part of the problem. Support becomes very, very important. And unfortunately, a lot of patients don't have support, and I'm talking about intimate support, support from, their relatives, support from their significant others. They just don't recognize that it's a real problem.
Yeah.
And I think that's unfortunate.
But it's mainly an invisible illness, I think, is one of the hardest parts of this disease. And I have to highlight the fact that that's why I have, go ahead.
But I think it's becoming more visible. I really think it's becoming more visible. I think more people are coming to realize that, there is an underlying problem. It's not simply a matter of will. That there are issues that have to be addressed, and it's just a question of getting, the right person, going to the right person to address those issues. Okay, but I think it's becoming a little bit more. I'm hoping anyway that it's becoming a little bit more recognized, and so people are not left on their own, in which obviously psychologically is devastating.
Well, that's why I have special place for you in my heart, but I have such respect and admiration for you because I told this story on my podcast, but when I walked out of your office, it was weird because I had just spilled my guts to you and I told you what was going on with me, but it's like I was screaming out for help and I just felt like nobody could hear me. And I just remember so vividly that you literally stopped me in my tracks and you just you may have even grabbed my shoulder and you just told me that I wasn't crazy. And you just told me that I believe you and this is real and I'm going to help you. I felt such pure, authentic, like I could get emotional talking about it right now because I felt seen and I felt like nobody had seen me and nobody had heard me. And I was in a crowded room screaming for years at this point, and my life was like sand just slipping out of my fingers. And everything I was trying to do to stop it was like making it go faster. And it was like, for the first time, it was like you reached out your hands underneath mine to catch it. Like, I'm going to help you and we're going to do this together. And like, you gave me some sense of hope. And I had never felt that before. So that's why it's so important to have you on the podcast.
Oh, no, I think, it's important to recognize that, I mean, it's not in your head. You're not imagining the stuff. I mean, you're not creating this because you want attention. Okay. I mean, you legitimately cannot function. I mean, that's the first thing that, that whoever's treating has to understand. You're not imagining this stuff. Nobody wants to live this way. Nobody wants to be this symptomatic. So the important thing is to realize that it's not in your head. No, and an antidepressant will not take care of it. And I get sick and tired of seeing patients who come in and they're taking 15 antidepressants and it's not doing a damn bit of good because the problem is not depression. And it's frustrating. You have no idea how frustrating it is to see patients who come in with a list of, pardon my French, crap that they're taking that is doing absolutely nothing for them. It's not improving their lives one iota. They still can't get out of bed. They still can't function. They can't put two thoughts together. Okay. I mean, they have so much cognitive dysfunction that they think that they're going crazy or they're, developing Alzheimer's. I mean, it's frustrating. It's incredibly frustrating, but again, I think recognition is going to, I mean, just again, as with chronic fatigue, as you know, for a long time, chronic fatigue wasn't even recognized as a legitimate diagnosis. Now it is, okay? And I think the day will come, when patients, who have chronic Lyme, will find, the medical community understanding that it's a legitimate condition and that has to be treated, and again, obviously, maybe I'm just hoping, but I mean, I do believe that the day will come, when it will be recognized. There will be therapies that can be done that most patients will respond to. Will every patient respond to it? No, but most patients will respond and they will see some improvement and they will be able to, have some kind of life, not just, stuck in the room, I mean, not able to function. So
I love that.
I'll get off my soapbox now.
No, I absolutely love it. I could go on for
Well, I
days.
get angry. I get very upset when I see some of these patients who come in with a long list of crap that they're taking that is doing absolutely nothing. I mean, it is just making things worse. Okay. And I also get upset because, I mean, in your case, with your stomach, that the gut is disregarded. I just take a couple of antacids, call me in the morning, take some Mylanta, whatever. And if you don't address that, if you don't address gastrointestinal function, you're never going to get anywhere, with treating Lyme, or the underlying problem.
Yeah. So along those lines, I did want to talk to you just briefly about how you go about treating Lyme, because when I first came on the podcast and started listening to the podcast, it was really hard for me to see myself in any of like the more common patients of chronic Lyme, because it seems like the normal route is to automatically go to that antibiotic treatment. And I know for me, because of my gut dysfunction, like you're talking about, that was not an option. No. So we went for about 3 years before we started antibiotics.
But even 5 years ago, okay. I mean, if a patient came in, yes, and antibiotics, were the go-to thing. Not anymore. I mean, I do antibiotics pretty much as the last resort. Okay. I mean, obviously the important thing is, you do an evaluation. I mean, look at inflammatory markers, address if there's significant amount of inflammation, you address inflammation, you take care of any hormonal issues that you have. and then you start building, immune response. You do things to build immune system, response. You do things to decrease inflammation, and antibiotics are reserved, much later on. I mean, there's things. I mean, I have patients who, I don't know if you know about LDI, and LDI. I've had patients who responded to LDI and who all
low dose immunotherapy, right?
Responded very nicely. I'm sorry.
Low dose immunotherapy, right?
Correct. And I've had patients who responded. I mean, I have a number of patients. All they do now, is LDI. They've gotten their lives back. They do a dose of LDI, pretty much, every 6 months, and they're perfectly fine. Okay. And I've had good response with the LDI. I'm very happy with it. Low dose naltrexone, methylene blue. I mean, there's all kinds of things that you can go to, to try and avoid the antibiotics. So I think in the long run, I think the antibiotics eventually cause more problems than they help. Okay. I mean, but again, because of the, if you commit to antibiotic therapy, you have to commit to doing at least 3 antibiotics. Okay. Mm-hmm. It's not just one antibiotic. Okay. One antibiotic is not going to do a damn bit of good, because the bacteria will revert to the form of the Lyme that is not being treated. So it's not going to do you a damn bit of good. Okay. Then the other thing that people forget, especially, when you're treating Lyme, is, the biofilm. Okay. And this is, this is a bacteria that wants to survive. Okay. And it will do anything to survive. Okay. And it will create a very strong biofilm. Okay. Which makes it very difficult, to get to. I mean, so even if your immune system is working well, it's with the biofilm is very difficult to penetrate. So that's something that you make sure that you address. Okay. So it's a bunch of different things.
Dr. Laufer, how do you do that, right? So what antibiotics specifically are most effective for the various forms? So for example, we have the spirochetal form, we have the round body form, we have the cell deficient form, we have the biofilm form.
Yeah.
What antibiotics do you recommend, or what treatments do you recommend to address each of those stages, or I'll call them, different morphologies, right? That taken together as a combination are most effective to treat Lyme? Because to your point, if I take one antibiotic for a spirochetal form, which is most common, it's just going to ball up into a cyst. And as soon as I'm done with the antibiotics, it's going to come back out to a spirochete, and it did no good, right? So what combination do you recommend?
Okay. And also, at what point do you even start with that?
Look, I don't start with the antibiotic right away. I mean, that's just, and I used to, and I have found them to be, not, it's something that I reserve when when I've tried everything else and patient hasn't responded. Okay. In terms of the antibiotic, and obviously with the antibiotics, you have to be careful. I mean, a lot of people have sensitivity, so you want to make sure that you don't create any issues. And again, if you have any kind of gastrointestinal issue, I avoid the antibiotics, because it's just going to rip up your gut, and it's just not going to do any good. You're going to create more issues. Okay. But again, this, the ones that I go for the intracellular form, I like rifampin. Okay, which I found to be fairly effective. I can, also use doxycycline. If you have a lot of, if you have a lot of, cognitive issues, a lot of central nervous system issues, then I think minocycline is a better choice, because it crosses the blood-brain barrier better. Okay, so minocycline, doxycycline. People have used, Zithromax. Okay, I like Zithromax, but preferred IV rather than oral. Then for the cell wall forms, you can use any of the xylins, penicillins. They work well. Again, the problem with that is that a lot of people are very much allergic to penicillin. Okay,
like me. Yep.
Yeah, and so that creates that really creates an issue. Okay, then you try you can do vancomycin IV, those kinds of things. And then for the cystic form, and the cystic form is the one that's most difficult to treat. Okay, that's the one that's much more difficult. So you can do, Tindamax, Plaquenil. You can do Alinea. Those are the antibiotics. But again, with the antibiotics, I reserve those, until the end. I don't know. I think Horowitz has a new protocol that he feels works really well for treating Lyme. Okay, and it's a dapsone. And I think doxycycline, dapsone, and I think rifampin. And you do it for 8 weeks, and then after you finish that, you do an additional 4 days of dapsone, doubling the dose for 4 days. And he thinks he's found it to be effective, especially in patients who are unresponsive to therapy, or who have a relapse. Again, the problem with that is, again, the gut, and that is the big issue. The big issue is the effect of the antibiotics on the gut. I mean, if you can do IV antibiotics, you can do IV antibiotics. There's some certainly IV therapies that can be effective. IV ozone has been found to be effective. If you have a lot of if you have a lot of cognitive dysfunction, you can use I'm blanking out now, but you can also use there's a laser, a Weber laser, which has been found to be effective. And again, no downside to it because it's not going to, it's not going to cause you any negative issues. The other thing that I have found to be effective is silver. Colloidal silver, can be very effective, effective against viruses, bacteria, funguses. Nothing has ever been found to be resistant, but you have to be careful. Make sure that you get the right kind of silver, otherwise you turn blue and it's irreversible. So
why is there so much controversy over silver? Because
I
silver,
don't know.
I don't understand that.
I don't know. I don't know. I use silver all the time. I use silver if I'm getting an upper respiratory infection or a throat infection, or if I have some skin issue. I use the silver and it works well. I'm a big fan of silver. I love it. I have my kids on it. One of my daughters never had Lyme, never had COVID. And all she does is, if she's going to go to a function or something, a couple of sprays of the silver. When she comes back, she sprays again. She's perfectly fine. She's never had the infection. She's doing marvelously well. So I don't know why people object to silver. I think it's great. I happen to love it.
And the colloidal silver can actually not only help prevent things like COVID and when you're going into a crowded room, but it also helps treat Lyme, right? It's also antimicrobial, correct?
Of course. And it's it also helps against funguses.
Yeah.
It's antifungal. I don't know. Silver is. I think. I prescribe silver all the time. I love silver. And
you had me on it for a while because I was starting to get a little mast cell activation syndrome.
No, but it's really great. I don't have a problem with that. And then for babesia, you use ivermectin. Although some people say, "Oh my God, horse medicine," but it's been approved for human use, and ivermectin can be very effective. You only have to use it once a week. Then the anti-malarials, the one that's really, difficult to treat. Okay, the one that tends to be the most problematic, okay, is the Bartonella, and that's the one that tends to cause the most problems, okay, in terms of treating, but again, you can use Bactrim, Septra, you can use Levaquin, which can be effective. So there's a bunch of different things that you can do.
Wow, that was a ton of gold right there, Dr. Laufer. I do want to ask you though, okay, so peptides, you talked about peptides earlier. What are peptides and how do you use them to treat your Lyme patients?
Peptides are combinations of amino acids that have been used to treat specific problems, okay? The problem with the peptides, and at least the problems that I have found, okay, peptides, can be oral, can be intranasal, or it can be subcutaneous, okay? In my experience, the oral peptides, their absorption is uneven, okay? The intranasal, much better absorption, but the subcutaneous is the best absorption, okay? And there's all kinds of peptides. Certainly you can use peptides, for inflammation. You can use peptides for immune, to boost immune system function. You can use peptides to increase, growth hormone release. You can use peptides for sleep. There's all kinds of peptides, that are in the market now, okay? Some people respond, some people don't respond, and that's the problem always, but I think a lot of it has to do with absorption.
What about BPC 157? We've heard a lot of good results with that. And I think
BPC 157 is great for inflammation. It's specifically for inflammation, okay? And it can be very, very effective. Like I said, the oral is not as effective, I think, as the subcutaneous.
And subcutaneous means basically it's like a needle, right? It's a needle injection, right?
Yeah, but you can also do intranasal. You can a couple of sprays each nostril. It gets absorbed really nicely because the circulation in the nose is very rich. So yeah, that can be very. For immune system, there's all kinds of different things. Thymosin beta 4, can be helpful for for immune system function. There's a, there's a KPDV, which can also be very good for immune function can also be good for, especially it helps a lot with gut, with gut stuff. I have found the KPDV very helpful, for dealing with a lot of gastrointestinal issues. Again, but the rate limiting step with a lot of the stuff is cost. I mean, the cost sometimes can be prohibitive, okay? And that is a big problem, okay? Believe me, I have patients who, I mean, the stuff helps, but they can't afford it. I mean, and it's a big problem, because, we're talking about, doing, multiple therapies for an extended period of time, and financially it can be devastating.
Let's talk about the second brain, right? You keep talking about the gut. So let's just take a minute to talk about that. The second brain, the gut, I think studies have suggested that the gut is responsible for 70% of your immune system. And when we're talking about the risks of antibiotics and the damage to the gut, even if it has success in killing off the microbes, Lyme, co-infections, et cetera, the damage it's doing to your gut is having such a detrimental impact on your immune system. It's probably going to have a lot of more long-term effects that are as a consequence of the antibiotics, right? So never mind gut damage from antibiotics, but generally Lyme patients have really bad gut health to begin with. What specifically do you do to help your Lyme patients with their gut health? Because that's such an integral part of the healing journey as well. Is that more a downstream effect, or is it something you do directly, or set of tools you do directly to address the gut?
The first thing, if gut issues are severe, then you try and avoid to do as many oral things as you can. Okay. That's the first step. Okay. Then obviously, you want to do some good probiotics. Okay. That can be very, very helpful. Okay. I have found in terms of, the KPDV, which I talked about, the peptide, I have found it to be incredibly helpful, in kind of, balancing your gut. And it's all about the gut biome. Okay. Just getting those, those bacteria, and, as we have trillions of bacteria, populating the gut. So, if you get those balanced, your gut function will be significantly better. The other thing is, believe it or not, even though you may think that you're not sensitive to foods, yes, you are, and so you have to start, food testing. I'm not a big fan of doing those tests for food, for food sensitivities, because in my experience, it comes back that this, patient is sensitive to everything except cardboard and water. And so what are they supposed to eat, which just becomes a problem. So just kind of, elimination, keeping a diary, looking for things that, will trigger significant, gut dysfunction. And avoiding those things, by just keeping a diary, eliminating one thing at a time for a couple of weeks, seeing what kind of an effect it has. And we're talking about things like, gluten, dairy, wheat, which tend to be the most common, inflammatory, trigger the most inflammatory reactions with the gut. So you start with those, but then you start, looking for things that potentially could trigger the dysfunction, and you just eliminate it and see whether it has an impact on the gut function. It really is just a process. And again, it's difficult to keep a diary, especially, if you, mentally, you're just not there, you're foggy, your memory is garbage, you don't remember from one day to the next. So that can be problematic. But at that point, you enlist somebody to help you, that's, you're not going to get better on your own.
Yeah. Dani, before we begin to conclude, do you have any final questions? I know, thank God you came in at the perfect time. Your internet issues earlier on were, I think, appropriate, because when you came back at the perfect time and were able to really, jump in at that part where I needed you the most. So thank you for that. But do you have did you miss anything that you wanted to ask Dr. Laufer, Dani?
Well, I was just curious. Obviously the gut health is just, it's.
Yeah, with you, the gut is the biggest problem, Dani. That is the biggest issue.
Since the day we met, I'm like, fecal transplant, what do we do? It's like so horrible.
Yeah.
But I think just for anyone in general, whether it's like they're stuck with the GI problems or chronic pain or whatever it is, it's like, I think people kind of misunderstand how difficult the battle is fighting Lyme. I know on our podcast, we've heard people refer to fighting Lyme is similar to like fighting cancer, in terms of like the treatments and the things that we have to go through. I do want to say that of all the things that you provided for me treatment wise for the first 3 years, I didn't struggle that bad at all. I didn't have any kind of die-off. I did the ozone, I did the silver, I did the Weber laser, and I had the same results to where I would be in contact in a room of COVID and I wouldn't even get it, because we were treating so well with so many things, which was extraordinary. Now you've had me on IV antibiotics for 4 months, and it's a little different now. So I understand where people are coming from in terms of it being very aggressive.
But always remember though, Dani, a lot of times when we do antibiotics, okay, you will have die-off, okay, which, you know, people, you know, kind of, you know, I mean, they think it's, you know, they're feeling worse because, I mean, we're not doing the right thing. But die-off actually is a very positive thing. I mean, I know that I'm not the one who's going through it, so it's easy for me to say, but it's a positive thing. It does mean that we're having an impact on the underlying problem. So die-off, and again, as you know, there are things that can be done, you know, to help with, you know, severe die-off reactions. Okay, but believe it or not, when I treat patients with Lyme, I mean, I'm looking for a die-off reaction. I actually want them to feel worse before they feel better, because it gives me an indication that we're on the right track. Okay, so
what can be done, Dr. Laufer, to address die-off and the Herxheimer reactions? You
well,
mentioned
you know,
there's some tools.
if it's not a severe reaction, there's something like Alka-Seltzer Gold can be helpful. Okay, I have found that patients who have severe reactions, the one thing that I have found to be effective is Actos. Okay, and Actos is a medication that was developed for you know, for diabetics. Okay, and if you ask me why it helps with die-off, I have no idea. I just know that it does, and you can take it 1, 2, 3 times a day, but it can be very effective. The other thing that has been found to be, I have found to be effective for severe die-off reactions is Singular, you know, which is, you know, it's a leukotriene stabilizer, okay, and it helps, you know, it does help with the die-off reaction. But again, I know it sounds terrible, but I want the die-off reaction. I want people to have die-off because it really points me in the right direction, you know. And so that's, and again, a lot of people don't understand that, you know, why the hell do you want me to feel worse? You know, I mean, I do want you to feel worse, but not for a long time. You know?
No, I appreciate you saying that, because sometimes when you're the patient, you're just sort of stuck in this, you know, purgatory of like, you're not better, you're still sick, you just kind of,
yeah,
get lost in it. So I think when you're reminding us of those things, it's super important. So
and it's important to, you know, to keep reminding, you know, I mean, because obviously I don't see patients on a weekly basis. Okay, and so I say something, and then 2 months later, 3 months later, I see them again, and they're telling me, you know, they're feeling terrible, and I try to, you know, tell them, you know, one of the reasons why you're feeling worse is because of what we're doing, and I get some very strange looks, you know, which is, you know, but it's okay. I'm used to strange looks. I don't have a problem with those.
well, I know you've seen it all with your patient. So that's kind of what my question was. That's where I was getting to with that was, I think people don't always realize that battling Lyme, it's a marathon.
But it is a battle.
Long journey.
And it is a battle. And it is a battle. You know, it is a battle. You know, you're fighting, you know, a really, really complicated bacteria that is going to do anything and everything it can to survive. And it's going to feed on its host. And it's a battle. And it really is a horrendous battle, you know. And again, you know, sometimes, you know, you mentioned cancer before, okay? And some people would rather, you know, you have cancer, at least you're going to die, and then you're going to, you know, you're not going to suffer anymore. You know, patients with Lyme, you know, they go on and on and on in Lyme, and they don't, you know, it's like, again, you know, like I said before, they're not living, they're just existing, okay? And it's just not it's not a nice way to, you know, to spend your life, you know, so.
I appreciate you saying that, though. I feel like it has a lot of gravity, because it only means so much coming from, you know, an invisible illness patient that's struggling and crying and doing this, that, you know, it's really tough. So I think for other chronic illness patients, but even their support systems, it's really important to hear a medical professional, you know, explain in that way.
And that support system, that's incredibly important.
Yeah, that does bring me to my last question. So it's a long battle we're talking about. It requires so many things in terms of long-term treatment, a supportive doctor, supportive family, all of these things. But I was just curious, because you have seen it all, is there anything that you've come across or witnessed or experienced that has really set a patient apart in terms of their healing journey, whether it be something spiritual, some type of support, some type of daily habit, or, you know, I mean, it could be a treatment, but is there anything that you've noticed, wow, this has really been made an impactful difference?
Really, the only thing that, you know, certainly, you know, I mean, support from those close to you is important, okay? I mean, having people, recognize the fact that you are ill, that you're not imagining this stuff, that it's not something that you're creating out of, just thin air, because you want attention. Okay. The other thing that I found, believe it or not, that I have found to be incredibly effective is, once, patient starts feeling a little bit better, I mean, physical activity, is incredibly important. I mean, and I'm talking about even, just going for walks, but any kind of physical activity. And the goal always with physical activity, my goal for patients is, if they can do like 150 minutes a week, without crashing. Okay. And that's important. If they crash, then it's counterproductive. They have to be able to, yes, be physically active, maybe a little bit tired, but a few hours later, they're fine. The next day, they're fine. They're back to baseline. But I think that I have found that, if patients are able to, to become physically active, it has a huge positive impact.
Okay, I'm taking notes, Dr. Laufer.
Okay. I am too, because I'm going to forget tomorrow what I said. So,
No, I'm just so grateful for everything that personally you've done in my life, but for sharing this with our audience is so important. And you're just awesome, Dr. Laufer.
So when I get hate mail, I can refer it to you. Is that the way it's going to work?
That's not possible. No, absolutely.
Okay.
Your passion for it. I feel like you're one of us. I mean, like, yes. You understand what we go through, and you're so compassionate.
But Dani, I am passionate about it because believe me, I mean, ultimately, I do want to help people. I mean, I know their struggle that they're having, and I do want to help them. Believe me, that is my one and only goal. I really want them to help. I want them to be able to. You don't know how wonderful it makes me feel to see a patient that I started treating, 10 years ago, and now they've got their lives back. They're married, they have they have kids, and we're doing just minimal stuff, and they're functioning, and that's what I want. I want everybody to be able to have that. That's what I want.
Dr. Laufer, I just want to tell you that as somebody who just met you today,
yeah,
your passion and your care and your desire to help could not be more apparent. I mean, your energy is just shining through this podcast.
Well,
I mean, I really don't know how to describe it for you. I mean, it is 1,000% clear that you genuinely care and want to help people. I mean, nobody can doubt that after this podcast.
Well,
nobody, hands down.
I do care. I mean, sometimes I bitch and moan and groan and complain, but I do care. I want all my patients. I mean, ideally, okay, given an ideal world, I want to see all my patients just once every 6 months. I don't want to have to talk to them. I don't want to have to, communicate with them. As long as they're doing perfectly fine. If I see them twice a year, that's all that I want. That's my goal.
Well, sorry, Dani. I just want to quickly the links for everybody, because if I think a lot of people may be thinking, well, how do I contact Dr. Laufer, right? So again, Dr. Moses A. Laufer can be found at holtorfmed.com. That's HOLTORFME. I said that wrong. HOLTORFMED.com. And there's a phone number. There's a request for an appointment on there, and you can suggest Dr. Moses Laufer as your doctor or recommend that. Dani, your social links, right? I think you're Instagram.com/Dani Tygr. Your handle is at DANITYGR. So if people want to follow you, I mean, you are an amazing, amazing presence out there advocating for this community. So you both are two powerhouses. I mean, you're literally wearing a Lyme Warrior t-shirt right now. People can't see it, but I know you're pointing to it. You're wearing a Lyme Warrior t-shirt, which is amazing.
I saw it, yeah.
And is there any other contact information, Dr. Laufer or Dani, you want to share about yourselves?
No. I can't think of anything else.
Well, I just don't want Dr. Laufer to hate me, because I know he wants to retire someday. But on behalf of the entire Lyme community, I thank you for not doing that yet, because we need you so much. We need your wisdom.
Dani, what would I do if I retired? I'd go crazy, and my wife would go crazy. She'd kick me out of the house so quickly, it would make my head spin. So, as long as I still enjoy what I do, I'll continue to do it. So, yeah. I still enjoy what I do. I still think I'm making a difference, so I'll continue to do it.
You absolutely are, and you have in my life from personal experience. But thank you so much for everything you shared on the podcast. You are affecting so many more people than you realize, and yeah, we just. I'm glad I was
a little bit of help. So I appreciate.
Oh man, you were more than a little bit of help. You were a whole lot of help. Okay. And on behalf of Dani, Rich, myself, but more importantly, the entire chronic Lyme community, we want to thank you for everything you shared with us. That is giving people tips and tricks to heal in their own journey, but also providing hope. Your story of hope was so powerful and inspirational. And I think that I don't want to lose sight of that. You provided so much hope, and tips and tricks, which is super rare for this podcast. So I just want to thank you for that, Dr. Laufer. Dani, thank you for recommending this podcast interview and helping us coordinate it. I mean, you are the mastermind behind this. So everybody listening knows Dani orchestrated this whole thing. She scheduled the whole thing.
Okay.
I mean, Dani's the brains behind the operations here. So
Okay.
thank you both so much.